Shazna Begum, student number S331985. Module title: Analyzing Strength and Limitations of Communication Styles. Today I will be discussing assertive communication and why it is such an important communication style within health and social care. Communication is one of the most essential skills for anyone working in health and social care because it allows professionals to understand people's needs, provide accurate information, build trusting relationships, and deliver safe, high-quality care. Poor communication can lead to misunderstandings, reduce patient satisfaction, and even serious risks to patient safety. Among the different communication styles, assertive communication is particularly valuable because it enables healthcare workers to express themselves clearly, confidently, and respectfully. It allows professionals to raise concerns, explain decisions, and advocate for patients without becoming aggressive or disrespectful. At the same time, it encourages active listening and mutual respect. Throughout this presentation, I will explain what assertive communication is, discuss its strengths and limitations, explore how it is used in practice, examine how it can be adapted to meet different communication needs, and finally reflect on what I have learned about its importance in health and social care. Firstly, let's look at what assertive communication actually means. Assertive communication is the ability to express your thoughts, feelings, needs, or concerns honestly, confidently, and respectfully, while also recognizing the rights and opinions of others. It is different from passive communication, where people may avoid expressing their opinions or remain silent even when something is wrong. This can sometimes result in important concerns not being addressed. On the other hand, assertive communication is also different from aggressive communication. Aggressive communicators may raise their voice, blame others, or attempt to dominate conversations, which can damage professional relationships and reduce trust. In health and social care, assertiveness should always remain calm, professional, and person-centered. Healthcare professionals should use clear, simple language, maintain appropriate eye contact and body language, listen carefully to others, and communicate respectfully regardless of the situation. These characteristics make assertive communication particularly effective when explaining treatment plans, discussing patient concerns, setting professional boundaries, and working collaboratively within multidisciplinary teams. There are several important strengths of assertive communication in health and social care. One of the biggest advantages is that it helps healthcare professionals speak up when they notice concerns or unsafe practice. Patient safety depends on staff feeling confident enough to question decisions or report risks without fear of conflict. Assertive communication also improves patient involvement when professionals explain information clearly and respectfully. Patients are more likely to understand their health condition, ask questions, and participate in decisions about their care. This supports shared decision-making and respects patient autonomy. Another important strength is that assertiveness helps build trust. Patients are more likely to trust professionals who communicate honestly, listen carefully, and treat them with dignity and respect. Within healthcare teams, assertive communication encourages collaboration. Nurses, doctors, social workers, therapists, and support staff all need to share information accurately. Speaking clearly while listening respectfully helps reduce misunderstandings and improves teamwork, ultimately leading to safer and more effective care. Although assertive communication has many benefits, it also has some limitations. One limitation is that assertiveness can sometimes be misunderstood. Even when someone intends to be respectful, their tone of voice, facial expression, or body language may appear too forceful, causing others to perceive them as aggressive. Another challenge is the hierarchical nature of many healthcare organizations. Junior staff may feel uncomfortable questioning senior colleagues or challenging decisions, even when they have genuine safety concerns. Workplace culture can also affect communication. In organizations where employees fear criticism or negative consequences, staff may avoid speaking up despite recognizing unsafe practice. Cultural differences are another important consideration. Communication styles vary across cultures, and what is considered appropriately assertive in one culture may seem too disrespectful in another. Finally, during stressful or emotional situations, maintaining calm and respectful communication can become more difficult. Healthcare professionals must therefore develop emotional self-awareness and communication skills to remain professional even under pressure. Now I will discuss how assertive communication is used in everyday healthcare practice. One common example is when healthcare professionals explain treatment options to patients. Assertive communication allows staff to provide accurate information and professional advice while still respecting the patient's right to make informed decisions. It also plays a major role in shared decision making. Rather than simply telling patients what to do, healthcare workers encourage discussion, answer questions, and support patients in choosing the most appropriate care based on their individual preferences. Assertiveness is especially important when raising concerns about patient safety. If a healthcare worker notices a medication error, unsafe procedure, or deterioration in a patient's condition, they must communicate their concerns clearly and confidently to protect this patient. Another practical example is during patient handovers. Structured communication ensures that essential information is transferred accurately between healthcare professionals, reducing the risk of mistakes or omissions. Finally, assertive communication is valuable during difficult communications, such as discussing complaints, explaining unexpected outcomes, or managing disagreements between colleagues. Remaining calm, respectful, and focused helps achieve positive outcomes in even challenging situations. Although assertive communication follow the same principles, it should always be adapted to meet the needs of different individuals. For example, when communicating with children, healthcare professionals should use simple language, shorter sentences, and reassurance to help reduce anxiety. Older adults may require slower speech, additional time to process information, or communication aids if they have hearing or cognitive difficulties. People with learning disabilities or communication difficulties may benefit from easy read material, visual aids, or alternative communication methods. Healthcare professionals should also adjust their tone of voice, pace of speaking, and body language so that their communication feels supportive rather than intimidating. Empathy is particularly important when patients are upset or distressed before providing information or discussing decisions. Professionals should listen carefully, acknowledge emotions, and demonstrate understanding. Finally, communication should always respect cultural values, personal preferences, and individual dignity. Adapted communication in this way helps ensure that assertiveness remains respectful, inclusive, and person-centered. There are several strategies that can help healthcare professionals improve their assertive communication skills. One effective approach is effectiveness training. I also recognize that assertive communication is particularly important when healthcare professionals need to raise concerns about patient safety or challenge unsafe practices. I intend to continue developing my communication skills through reflection after conversations and clinical experiences, reflecting on what went well and identifying areas for improvement will help me become more effective communicator in the future. Overall, assertive communication is one of the most valuable communication styles in health and safe social care. When it is combined with empathy, adaptability, and respect, it strengthens professional relationships, improves patient experience, and contributes to safer, person-centered care. Thank you for listening. I would be happy to answer any questions. Thank you.